There's so many miles where there's no access to foods at all. A convenience store might be your only source.
Greens, which we love, we will have to drive to Clarksdale to get it.
And our scholars are much more attentive, alert. They make more academic gains when they're not hungry.
A lot of times these are the people who are having difficulty purchasing these fresh fruits and vegetables for their children.
Hello and welcome to Southern Remedy. I'm Dr. Rick DeShazo.
And I'm Melissa Faith Payne.
In the land of plenty, we have food deserts. These are areas that lack access to affordable fruits and vegetables, whole grains, low-fat milk, and other foods that are essential to a healthy diet.
The town of Alligator is one of the many food deserts in Mississippi. We'll meet people who live there and see what steps they take to put food on the table.
We're just a small town. We mainly have just 3 grocery stores here, you know, two others beside mine. We try to offer a good variety to save people from having to go to town. We have fruits, vegetables, milk, bread, fresh meats, some groceries, and we carry other things too.
I don't know about much of the food products that's in the store in Alligator. I've always went to Kroger's and got mine out of Kroger's.
We live about 15 miles from a big store like Kroger's.
I go once a week, and I usually try to go on a Saturday, and I try to get enough to last me to the next Saturday.
I don't have transportation of my own, but when I get ready to go to town, I ask someone that's going. I arrange everything where I can go when other people go. And I buy what I need to last at least 2 weeks or more. When I ask someone to take me sometime, I have to pay a fee. And so it's kind of hard to pay a fee and then have money to buy groceries.
My name is Christine Bennett, and I'm originally from Alligator, Mississippi, and I take care of my grandmother, who's 89 years old. For preparation for my grandmother, Vermillion, we usually do a checklist, go through the cabinets and see the items that she needs, mostly like sugar, meal, flour, milk. Typical meal would be baked chicken, greens, cornbread, corn on the cob. The local store is probably less than a half a mile away, but usually we still have to go to Clarksdale to get most of the items because they don't carry everything that we need. But if we just need, you know, soda, milk, eggs, you know, local little stuff, we can get it from there. Greens, which we love, we will have to drive to Clarksdale to get it. Clarksdale is about 13 miles north of us, so that's the closest.
Off to the store. I make this trip about 3 times a week to Clarksdale.
Researchers and advocates are working to help shape food policy in Mississippi. Teresa Hanna is with the Center for Mississippi Health Policy, and Sandra Shelson is with a Partnership for Healthy Mississippi. They talk with Melissa about food policy and how it affects food availability in schools and communities.
Sandra, are there any access to food programs that are kind of helping this change along?
Well, there is a bill that was passed in this past session to try to create a healthy food financing initiative. Unfortunately, there's no funding attached to it right now. We're trying, the Mississippi Development Authority is the state agency that's to oversee it. And essentially what it does is create a pool of money that can be leveraged with different funding mechanisms like new market tax credits, some of the community block grant funds that come into the state. And I mentioned before, like say a mom and pop is going out of business. Well, maybe it just needs an upgrade. So they could apply for a loan through this program and they would be able to get their store sort of reconfigured where maybe a kiosk in the front with fresh fruits and vegetables. Right. This would also help farmers markets. It would look at convenience stores. When you're looking in the Delta, where there's so many miles where there's no access to foods at all, a convenience store might be your only source. And so this would also allow them, either through a grant or a low interest loan program, to provide those. Let's say take out a freezer in the back that has maybe beverages in it, and let's put in one that has frozen fruits and vegetables that aren't prepared, that are ready to take home and prepared, not processed.
We were talking about the Farm to School program. Talk a little bit about that.
Well, we're trying really hard to, the partnership has a grant through the United States Department of Agriculture to work with farmers and school districts to bring it together, kind of like like Match.com, trying to encourage farmers to be willing to work with the school district and the school district to reach out so that we can buy locally and have fresh fruits and vegetables from our own farms brought in. The first week in October is designated Farm to School Week here in Mississippi and actually nationally, and so there's some challenges to it, but if you look around, you're seeing more of a farm to table type movement, farm to institution, farm to school, and that's good for our farmers, which is good for business, but it's also good for our overall health. Let's try to focus on the great foods that we've got right here in Mississippi. And then that encourages these farmers to be more innovative and maybe extend the growing season so that some of these crops that we might have just a couple months with, let's have it longer. And all of this is kind of going on through, we have a Food Policy Council that's looking at it, the statewide Obesity Prevention Coalition is working towards it, and then we have, like I said, a strong farm to school movement that's getting started here in Mississippi.
In 2007, the Healthy Students Act, the legislature enacted that. Talk a little bit about what that is and what's that meant for Mississippi.
Well, it's a very comprehensive act. It's one of the most comprehensive in the nation, actually. It looked at improving physical activity, nutrition, health education, and the structure of health in the school.
Teresa, you guys did a lot of research and collected a lot of data in relation to this act. Talk about some of your findings.
We did a 5-year evaluation of the impact of the Healthy Students Act, and we contracted with University of Southern Mississippi, Mississippi State University, and University of Mississippi to do the research in the schools. They had researchers go into the schools and look at the food environment. We had researchers who surveyed the parents to see what the home environment was like. There are researchers who used school nurses to weigh and measure the children so we could get a very accurate measure of childhood obesity rates. What we found is the schools were transforming their health environment right after the act. The nutrition environment was truly transformed. They have reduced fried foods tremendously. They have increased whole grains that they've offered. As I mentioned earlier, they got rid of the sugar-sweetened beverages, except for high school has sports drinks. And they've increased physical activity. They've established the school health councils. Major changes.
But Sandra, we still have obese children here in Mississippi. Why is that?
Well, it's a very difficult issue to address, and there's a lot of people who don't have the education that they need yet. I mean, the act is only 2007, so we're educating a group of children, but we have generations of people who don't understand what they need to be eating and the correlation between physical activity and good nutrition. I mean, a lot of people don't even really know some of these good vegetables that we have. They've never had a Brussels sprouts. They've never had broccoli. They think that French fries might count as the vegetable. So we have a lot of education to go with the children.
When we talked earlier, you talked about an elementary school, though. That's where you're seeing the drop-off, maybe, when it comes to childhood obesity. When I went to my son's school, they were serving salads. He's in the 1st grade. It's so interesting to see those kids actually eating salads who probably in their homes may not be introduced to that type of food.
Yeah, the elementary school is where the school really has more control over the environment in terms of what the kids eat and their activity. And that's where we've seen so many of the changes occur. And that is the area where we have seen a statistically significant drop in obesity rates, and also when you look at overweight and obesity. So we're seeing the most change there and improvement in the health of the kids. And that's also where we've seen the most change in terms of the environment.
Well, Teresa, you guys had some nutritionists actually go into the school and talk about fruits and vegetables and what a serving size was, and had some surprising findings.
Well, they went in to evaluate the environment of the schools, and they looked at what the schools had, and schools actually had done really well with compliance with like the vending machines and so forth. And then they looked at their menus for 4 weeks and how much they were offering fruits and vegetables and that kind of thing. And they found that the schools were doing a pretty good job with the variety of fruits and vegetables. They had trouble with finding fresh fruits and vegetables to serve every day, which is what they were supposed to do.
My name is Serenity Luckett. I'm the principal of Brown Elementary. This is my 5th year as principal here. We have about 210 pre-K through 5th grade students. We're located in the Midtown area of Jackson, Mississippi. 100% of our students here are designated as eligible for free and reduced lunch, which means that all of our students are able to come to school every day and receive 2 complete meals. We also have a fruit and vegetable program. This is a snack program that allows for all of our scholars to receive a healthy snack during the school day. Some of our scholars come to school and those are the only meals that they get all day. They may not have dinner. We have a very high attendance rate, I believe partly because of all that we offer in choices for food as well as complete meals and snacks.
My name is Mary Hill, and I am Executive Director of Food Services for Jackson Public Schools. The Healthy Hunger Kids Act of 2010 recommended a number of changes in how we feed our children across this country. First of all, it changed the meal pattern, which is the requirements that school districts have to follow in order to plan our menus to serve to our children. That was both for breakfast and for lunch. They're seeing more grains, they're seeing more fruits and vegetables, and our goal is to look at what we serve and look at what it is that they will eat and try to combine the two. We don't want them to be thinking about the mere fact that my stomach is growling and I need food. We're doing a lot of variety of things that children probably would not have an opportunity or would not want to eat if it had not been that I ate it at school. Our cooking techniques have even changed. We in Jackson Public Schools are not frying. We may do a small amount, but our goal is to do no frying. As a part of the dietary guidelines, and we also have to keep in mind that it is moderation, that really we should not be teaching children that there are bad foods and that there are good foods. It is how you eat those foods and how often you eat those foods, I think, is the key factor. We're just very privileged this year to be using community eligibility provision, and our students have been really excited about it. Our parents have just been, I've gotten so many positive calls from parents just telling me how much that puts back in their budget, that they had counted for lunch money. So I think it's just an added plus that our students now have one less thing to worry about, which really for us enhances the learning process.
Nutritious food is brain food, and our scholars are much more attentive, alert. They make more academic gains when they're not hungry and they're able to feed their brain and bodies. Since we've had the clinic and the backpack program, the breakfast in the classroom program, all these programs have contributed to scholars making better choices. Even in the cafeteria, they have more options with fruits and vegetables, and they're more willing to try those options. About half of our students are provided backpacks every Friday before they go home. The Junior League and the Mississippi Food Network actually work together to pack the meals on a weekly basis. And in those backpacks, our students have at least 2 complete meals and snacks. Now we try to recruit, if you will, siblings and family members so that we don't send one student home that may have a food bag and 4 or 5 other children live in the house and don't have access to that food, so that they have a good amount of food coming home to them.
Dr. Rick talks with Cassandra Mobley with the Mississippi Food Network and nutritionist Rebecca Turner from MPB's Fit to Eat about the efforts to get fresh fruits and vegetables to children and their families.
What are the barriers that the two of you are seeing in getting access to food? I mean, we are a farming state. We have the richest agricultural areas in the United States, and we're having to backpack food that has some kind of shelf life home on the weekends.
You know, well, we are an agriculture state, but one thing that even lacks the Farm to School program, which is been in existence since about 2002, the Department of Defense finally got funds available to use some of the endowment entitlement money to purchase fresh fruits and vegetables from our Mississippi farmers to put into schools. Here in the 2014-2015 school year, we're almost up to $1 million in fruits and vegetables from our farmers into schools, and it is expanding into about 100 other schools. That's the plus. Now, the roadblocks even there are that we don't have the variety of fruits and vegetables in Mississippi, specifically the fall and winter sort of vegetables, to be able to put into the schools enough. We are a very large agricultural state, but we aren't a very diverse in agriculture states, so there's not a whole lot of broccoli or cauliflower, some of these other vegetables being grown. Our farmers do a great job of the crops that they do. We lack some of that variety.
Now, what you're doing is actually driving, you know, she says, in order to grow the availability of these fresh fruits and vegetables, there's got to be a demand for them. And some of your work actually creates that demand directly with the farmers, right?
Well, it does. One of the things at the Mississippi Food Network we like to do is build the capacity on the local level of some of our partner agencies that are giving food to people in need, to people, low-income people who have children who they're having difficulty feeding. You talked about people who are working 2 or 3 jobs trying to make ends meet. A lot of times these are the people who are having difficulty purchasing these fresh fruits and vegetables for their children to keep their diets healthy, and that's kind of where we step in and try to build the capacity of our local agencies to be able to handle those types of fruits and vegetables, to get them to these people who don't have access to them. There may not be any available in their immediate area, and if they are available, if they're in a small town that's pretty far away from a large metropolitan area, they have to pay much more for them than we would.
Now, where does this food come from, and how does that work through your particular program?
Through what we do. Well, as a food bank, we get donated items in. Of course, we take food donations from manufacturers and from organizations that produce food. Of course, we do purchase food, and we use our purchased food to try to buy the fresh produce. I would say 80% of the food that we do actually purchase is fresh produce. So we do try to get that out. There are some barriers to that with the agencies that work with us to get the food into their communities, because they're not always set up to refrigerate or hold food for very long. So if it's a perishable product, we have to make sure that they have the capacity to be able to get it to the people in need. And if I could jump in, talking on behalf of the South United dairy industry, milk is one of the top 5 things requested at a food bank, but it's one of the lowest able to receive because there's lack of storage space for low-fat milk, cheese, or yogurts, which we know have nutritious benefits for the people receiving it.
So let me get this straight. You're trying to give and get food to these kids who basically are food insecure and could go the weekend without getting enough to eat.
Yes.
And there are barriers that are being brought up, simply things like refrigeration and other.
Right. But there's great efforts in that. The National Dairy Council is partnering with Feeding America to get funds to put sustainable refrigerators in food banks and food pantries that will allow the other producers, such as your Louvelle's or your Borden's or your Prairie Farms, to make large donations of their perishable products that can get out. Prairie Farms just donated 500 gallons of milk to the food bank. It was gone within 24 hours because they had to distribute it, or there was nowhere for them to store it. So
Well, that is great, but I constantly hear criticism of parents who don't feed their kids right. Okay? They're bad. They feed their kids nothing but processed foods and fast foods. They're working 2 or 3 jobs. But when you go into those areas, there aren't any fresh foods around. Many of them don't have stores. Bananas are sitting on the checkout counter that are $1.75
Right.
a piece. How do we get past that?
Well, at first, you know, a lot of times your supply drives, or demand will drive supply into those areas, because from a, you know, even a convenience store owner's perspective, they have to purchase those fresh fruits and vegetables, and that's overhead. Well, if their overhead, you know, literally goes bad before a consumer will choose to buy it, that's bad business. So you have to also be compassionate on the business owner side until the want is there from the community to purchase it. Then the business owner takes the really big risk on putting this out. One way to deter that is getting more freezer space, which I have seen in some of our dollar convenience store type places that can hold frozen fruits and vegetables. Although it's not fresh, it's the next best option because it has a longer shelf life for the business owner to help push. So that comes in from awareness, really getting the community to the level where they want to. But you know, as a registered dietitian, one of my biggest roadblocks is that the majority of Americans are educated over their level of obedience. You know, when I worked in the low-income setting doing nutrition education, most of your kids know that apples are a better choice than French fries, yet French fries are still take the place of a quarter of all the vegetables, not potatoes, all the vegetables eating in America. The average adult and child are eating 4 servings of French fries every week.
What determines food choices in children?
Well, often children are a product of what their parents feed them. So it is environmental more than I would say it's genetics. How the parents choose to buy foods and prepare them at a very young age sets the stage for what a child is pretty much used to and wants to eat for the rest of their life.
So if the parents are familiar or have the health literacy to understand what is healthy and what is not, and present healthy foods, the kids will tend to choose those going forward?
Oh, absolutely, and vice versa. So if you have overweight parents, usually you'll have overweight children, not necessarily, again, because of the genetics, but because of the environment. You grow up eating things and you tend to want to stick with those habits for a lifetime. It's much harder to break habits as you get into, you know, past 5. We see that food preferences are set by and exercise preferences are set by the age of 5. If those aren't instilled, it's hard to backtrack with a kid once they've reached their teenage or even early adulthood into cultivating these healthier habits.
My name is Claude Mapp. I'm the CEO for Gleaners. A gleaner it comes from the Old Testament times. After the fields were harvested, people would go in and they were allowed to take over whatever was left over after a harvest. And that's kind of what we do. We go to the grocery stores and it's products that are out of sale date, but they are still good and usable for the public. And we take that, bring it back here, and distribute it out. I like getting out, you know, going to the grocery stores and picking up the food, interacting with them, and being able to see on both ends of the spectrum, you know, the giving and the volunteering from, you know, the people who give to us and to the people who receive from us, and all the volunteers that work here, because this is a complete volunteer organization.
My name is John McGlory. I'm a 10-year volunteer of Gleaners. There was over 1 million pounds of food that came in here last year. You can see for yourself the amount of food that would go in the garbage if it weren't for Gleaners. And it's amazing the amount of food that is being thrown away that can be recycled to help the needy. A lot of the fellows you see in here are from some of these shelters that Gleaners gives food to.
Distribution is approximately, I think, about 70 halfway houses and shelters. Stew Pot is one of them, and they have like 3 or 4 branches under their umbrella that we give to. And where we differ from a food pantry is most food pantries is staple items. It's canned goods, rice, beans, things like that. We actually get in fresh produce, fresh meat, and you know, it may not look sexy, but it's still very good and still usable. We look at the shelters and the halfway houses, you know, who are able to cook, who are able to use this. I see the amount of food that goes through here on a daily basis, you know, and still boggles the mind that we have hungry people in Jackson, Mississippi. And we are, you know, we're trying to give it away as fast as we can with all the organizations that we work with. It just boils down to somebody saying, going to the right, you know, getting the people in need to the right organizations to say, here, we can help you.
Visit mpbonline.org for more information about food access and hunger in Mississippi.
Thank you for joining us.
For all of us here at Southern Remedy, good night.
Southern Remedy is underwritten by a grant from the University of Mississippi Medical Center.